Assalamualaikum warahmatullahi wabarakatuh and a very good morning to all. Ladies and gentlemen, I would like to invite all the guests to be ready as the webinar will begin shortly. Before we get started, let me just go through the housekeeping messages in brief to ensure our webinar today will run smoothly and you can interact effectively with all the panels. Firstly, we seek your full cooperation during these entire webinar sessions. This webinar is being recorded. All participants are automatically muted by webinar administrations. For question and answer session, please type your questions in the Q&A feature which is located next to the chat icon on your WebEx or the chat box on your viewing platform. Questions will be answered at the end of each presentation. Links for NRP documents and feedback form for e-certificate will be shared at the end of the webinar. Your cooperation is much appreciated. Thank you. Bismillahirrahmanirrahim. Greetings to invited moderator and speakers, health professionals, nutritionists, researchers, academicians, officers from the research management centers, and all participants. Ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. A very good morning and welcome to all. Today's webinar is brought to you by the Technical Working Group on Nutrition Research under the purview of National Coordinating Committee for Food and Nutrition, NCCFN, Ministry of Health, Malaysia, and jointly organized by the Faculty of Health Sciences, University Technology Mara, UiTM. I'm Megar Rushdi from Nutrition Division, Ministry of Health, Malaysia, and it is my pleasure to be your MC for today. I would like to extend a very warm welcome to all of you and thank you for being here with us today. Alhamdulillah, we are thankful to Allah because with His bounty and permission, we can gather virtually today for our webinar on Nutrition Research Priorities NRP Series 2 2022, Life Course Approach to Food Intake and Dietary Practice Nutritional Deficiencies and Excesses. Ladies and gentlemen, to begin this webinar, we are pleased to have Dr. Nalina Devi Munyandi from University Technology Mara as our moderator for today's sessions. Dr. Nalina has been a senior lecturer in Nutrition and Dietetics Department, UiTM, since 2009. She received her PhD in Public Health from Monash University in 2020. Prior to working in UiTM, she was also a clinical dietitian in Damansara Specialist Center and Ampang Puteri Specialist Center. Without further ado, I welcome Dr. Nalina Devi to moderate the next session. Over to you, Dr. Nalina.
Thank you very much for the kind introduction, Encik Migat. Good morning, professors, doctors, researchers, clinicians, and my fellow audience. Thank you very much for joining our webinar on Nutrition Research Priorities Series 2 that will cover on life course approaches to food intake and dietary practices and nutrition deficiency and excesses. Now, before I introduce you to our distinguished speakers for today, I would like to invite Professor Dr. Hamid Jan for his welcoming speech. Now, a little bit on Professor Dr. Hamid Jan. Professor Dr. Hamid Jan has been a lecturer with the Nutrition Program, School of Health Sciences, University Science Malaysia since 2007. He joined this institution immediately after completing his PhD at King's College, London. He holds a master's degree in nutrition from University Kebangsaan Malaysia and bachelor's degree in nutrition and community health from University Putra Malaysia. He received extensive training on laboratory skills from the Diploma in Medical Laboratory Technology courses in USM. In addition to teaching undergraduate students, Professor Hamid has successfully graduated 9 PhD and 10 master students and currently is supervising 11 PhD students on various research topics. Professor Hamid also works closely with the Ministry of Health Malaysia and is a committee member in the Technical Working Group for Nutrition Guidelines involving children, adults, and also the elderly. Dr. Hamid is currently the chairman of the Technical Working Group for the Ministry of Health Malaysia. Professor Dr. Hamid, the floor is yours.
Thank you very much, Dr. Nalina. I hope you all can hear me clearly. Thank you for moderating this important session. And I also would like to thank University uh, Technology Mara for collaborating with us with Ministry of Health in organizing the second series of our NRP. I think this is a very important occasion for us, and I really would like to also thank the committee members of TWG Research who had been working very hard so that we all are able to listen and learn. And personally, I would like to thank Siti Abaria Buhari, Associate Professor Dr. Norma Julo, Dr. Nurul Fadila Abdullah, and also Professor Dr. Swing. I think they are very helpful, they are very cooperative, and they are very happy to share their experience and expertise with us today. And I personally really appreciate their kindness. Ladies and gentlemen, I just want to reiterate that we will have several series of NRP, and this is the second one. And please join all our NRPs. Because why I'm saying this is because our NRP seminar is very unique. We don't only share the details of the research, but we also share the experience of the researcher, the experience with regards to how they are able to prepare an interesting research proposal, how they are able to prepare an interesting grant application, and finally winning the grant such as FRGS and international grant and etc. This is a very important platform. An NRP technical working group for research wants to create a platform where everyone can hear from another person, regardless where you are. You can be in USM, UPM, UKM, UITM, and we all join this webinar and we learn from each other from this small fraternity that we have in our country. And by learning this, you are able to grasp some important knowledge on the techniques and strategies that is important for you to win the grant. So I think please make use of this session. Please learn as much as you can and apply this. We want to improve the nutrition research in Malaysia. That is our aim. When I say improve, we want people to have new ideas. We want people to create new knowledge. We don't want you to reinvent the cycle, doing the same thing. So this platform will be able to make sure that all nutrition research in Malaysia will be looked up by many people, not only in Malaysia but also in the global region. I think that's all from me. I think my welcome speech is not that important. The content of the speakers is more important, and I look forward joining and listening from them. Thank you very much. Assalamualaikum.
All right. Thank you very much, Prof. Hamid. Okay. Hope his welcoming speech would be an eye-opener and also would motivate all of us to further equip ourselves with knowledge and tips that would be shared by all our distinguished speakers soon. Now, before that, I would like to introduce our four panelists for today. Right, our first speaker would be Dr. Siti Sabaria Buhari from University Technology Mara. followed by Professor Dr. Nurmah Juso from University Pendidikan Sultan Idris, and followed by Dr. Nurul Fadilah Abdullah from University Pendidikan Sultan Idris also, and lastly, Associate Professor Losupeng from University Putra Malaysia. Now, before we start our session, I would like to invite the MC, Prof. Hamid, all our speakers to switch on their webcams for a photography shot. Okay, I would like to invite Professor Hamid, the MC, and also our distinguished speakers to turn on their webcam for a photography shot. Just before we start our sessions.
Okay, everyone. In count of three, 1, smile. Another one take. 3, 2, 1, smile.
All right. Thank you, everyone. Okay. So coming back track to our webinar today. So we would start with our first speaker, which is Dr. Siti Sabaria Bukhari. Now, introducing our first panelist for today, Dr. Siti Sabaria Bukhari. She has been a senior lecturer at the Center of Dietetics, Faculty of Health Sciences, UITM, for the past 17 years. Dr. Siti Sabaria obtained her PhD in nutrition in 2017 from UKM. Prior to that, she had her master's in community health in the year 2003 from UPM, and she had her bachelor's of sciences in nutrition and community health way back in 1999 in UPM. Again, Dr. Siti Sabaria has 17 years of teaching experience in UITM. She has been an author for various Malaysian dietary guidelines such as the MDG 2020, Malaysian Dietary Guideline for Vegetarian 2020, Malaysian Dietary Guidelines for Children and Adolescents 2020, and Maternal Dietary Guidelines for Malaysia 2022-2024. Now, Dr. Siti's research work area covers mostly on obesity and program for overweight and obese children, right? And she also has got a lot of research projects and also experience in coming up with modeling. So she's currently involved in the development and evaluation of health education module on childhood obesity management, modeling a culturally tailored web-based nutrition education for low and middle income patients with hypertension, and also modeling a theoretical conceptual framework on limiting consumptions of high energy dense snack foods and sugar sweetened beverages in adolescents. Now, Dr. Siti is also interested in the area of research on food preferences of children with autistic spectrum disorder. Now, having introduced you to our speaker for today, I would like to welcome Dr. Siti Sabaria for her speech. Thank you.
Okay, thank you, Dr. Nailina. Allow me to share my slide first. Can see my slide? Okay, Assalamualaikum and a very good morning to respected Chief Guest, Prof. Dr. Hamid Jan, Chairman of NRP Technical Working Group, All the panelists, Associate Professor Dr. Norma Juso, UPSI, Dr. Nurul Fadilah Abdullah from UPSI, Associate Professor Dr. Lo Supeng from UPM, and ladies and gentlemen. First of all, I would like to thank the organizers of this event for inviting me here today. It is an honor to have the opportunity to address such a distinguished audience here. Okay, I'm here today to present on my experiences in the grant application process, the challenges that I face, and some tips for writing a grant application. So we go easy, tak payah nak formal sangat. So first of all, I would like to tell you that I am a recipient of the FRG Grants Award in the year 2021, and the title of my research is Modeling a Digital Intervention Framework on Limiting Consumption of High Energy Dense Food and Sugar Sweetened Beverage among Adolescents in Malaysia. Okay, as I requested to share my experience in the grant application, I would like to highlight that it was a very long process. Okay, here I'm sharing you my grants system, and you can see that I tried, apply for FRGS 4 times since 2018, and finally I got the grant in 2021. So it's not easy, it's not easy, but it doesn't mean that it's so difficult. It's just actually a learning process that we have to learn from all the mistakes we made in the previous years. We keep on improve the proposal, again and again, and never give up, and definitely, inshallah, one day you might get the grant. So never give up on those who have not gotten the grant yet. Keep on trying. Okay, so this is first, I would like to give you an overview of my research. So as a research background, so we can see that I think all of you know that Malaysia is now the most obese nation in the Southeast Asian region. And this practice of eating out, makan luar, and also the preferences of a big portion, lagi besar, lagi glamour, lagi virals, the big portion of high energy dense food, and also the SSB, the sugar sweetened beverages, had become a trend in Malaysian adolescents, which has proven to be a contributing factor to obesity. So as adolescents in worldwide and also in Malaysia are the highest users of social media, so it is actually, there is a potential for this social media, to support adolescents and young adolescents in maintaining healthy diets and learning about nutrition. So research proved that social media is a promising feature for nutrition intervention on adolescents and young adults. Okay, why I'm doing this research? The justification and what are the research gap I found based on my literature review. That is, so far there is no specific framework, especially on developing a digital intervention. I'm not talking about the module of intervention, but I'm talking about the framework. Usually it's good, right? We have a theoretical framework when we want to develop an intervention and etc., right? So there is no such a specific conceptual framework, when it's come to conducting or developing a digital intervention, specifically on SSB and also HID. So that's the reason why I get the idea to come up with this proposal. Okay, so what is the objective of my study? The main aim of my study, definitely, I just want to develop a digital intervention framework. It's a framework, not a module. A framework to limit the consumption of HED and SSB among Malaysian adolescents based on a theoretical framework. So overall, I have 5 specific objectives. So my first objective is actually I want to identify the model and theories that use in developing a framework specifically on digital intervention. For this part, usually my study will focusing on the systematic review, literature review, and I will find out what theories has been used when it's come to a digital intervention, especially related to diet. And my second objective is to identify what are the components and elements preferred by the adolescent when it's come to digital intervention, which kind of color they like, what kind of content they would like, is it have to be shorter, longer, more wording and such a things, okay? And my third objective will identify the components and elements required in developing a digital intervention framework based on the experts' opinions. Okay, and objective number 4 is on the developing the framework. And my final objective is to evaluate the validity of the developed framework. Okay, next on the methodology, basically my study consists of 3 phases. The first phase is on need analysis. So for the need analysis, the methodology, some things related to the systematic review and also some in-depth interview involving adolescents in Malaysia, where we want to identify what are the things that they prefer, they don't prefer when it's come to digital intervention. And then on the second phase, where there will be a design and development of the framework. And then on the final phase, phase 3, I will do the validity of the developed framework with the different types of methodology and approach. Okay, it's very simple. It looks simple, basically it's very complicated. Okay, next, what are the results that I'm expecting from this study? Definitely, inshallah, this finding will produce a comprehensive digital intervention framework that will be a reference for any health professionals in developing a digital, especially on social media intervention. So I really hope that in one day, when there is any health professional or any NGO, any companies, industry, they want to come up with an intervention, so they can refer to our framework to develop an effective intervention related to eating behavior, specifically on SSB and HED. Okay, basically, I just want to clarify here again that I'm not developing any intervention for FRGS. FRGS is fundamental research, right? So for fundamental research, usually we don't do intervention studies. What we will do, we will identify the fundamental factor, the very fundamental factor of any research. So that's why this study, for example, this is an example of one model of internet intervention that I got from my literature review. So at the end of my study, this is I will create something similar to this. Okay, so in terms of whether I'm going to do the intervention or not, that might be the next step of my research. Maybe I'll ask for another grant and etc. so that I can use my framework here to develop the real intervention and see the effectiveness of it. Okay. Okay, what are the current status of my study? Okay, currently I'm in the middle. Actually, I'm in the middle of preparing for phase 2, the need analysis. I'm already conducted, me and my team, we already done with the systematic review, and now in the phase 2 to do the need analysis. Okay, inshallah, I still have my time until September 2023. Okay, so there will be more sleepless night for me so that I can finish in the time given. Okay, so what are the challenges I've faced specifically when related to this study? This research is definitely getting a postgrad student. So that will be the most challenging things to get the students. Okay, even my study, I have to delay the study for about 3 months because I couldn't get the student at the beginning. But alhamdulillah, currently I have one master student dealing with the research. But I really hope that I can get a PhD student, okay, so that the student can do the overall study. For master student, usually they will focus on a specific part. Okay, definitely that's the most challenging things. And the second one is time constraints. Okay, me as an academician have to follow all the deadlines and other commitment, my work commitments, and then the workload management, the resource allocation and things like that. Which I think that way we cannot, I cannot avoid all that because of my responsibility as academician, but I think the time management plays an important role when we want to involve in any research. Okay, so that's all on my research. I think I don't want to talk much about my research because it's still ongoing research. There is no any results that I can share with you. Other than that, let's say we have time, right? So I would like to share with you some tips for writing a grant application based on my experience. Okay, I'm talking about my experience. This is not necessary to be right or wrong. This is absolutely from my experience. So tips number one, allow plenty of time when you want to do your grant, when you want to write a grant. Okay, it's not a matter of you get the iklan grant and then in one day you can finish writing your proposal. As I mentioned earlier, yeah, it's take me about 4 years, okay, to come up with the perfect proposal. Okay, usually what I'll do when there is any grant offer anyway, I will focus about minimum of 3 months. Okay, 3 months. Start from finding out the research gap. Okay, what are the things that I want to focus? What is the need and requirement of that grant? Because different grants will give you different focus. Kita kena tengok which one they are really referring to, which are really they are for offering in their grant. So we have to look at that. So that really use lot of times. Okay, you kena ambil masa yang sangat lama untuk think about what you really research you want to do and spend a lot of time, do a proper methodology, the clear one, the precise one, make sure you have a clear objective and everything. So you allow plenty of time when you want to write a grant application. It's not a matter of you can finish, nothing to be proud if you can finish your proposal in 3 days. Okay, selalunya if you take a shorter time, there will be a lot of mistake you will find in your proposal. Okay, so my tips number 2 is get advice at an early stage from a range of sources. Okay, don't be shy. Don't ever be shy asking people for help. Okay, it doesn't mean you're weak. Definitely, it only means that you are wise. Okay, the more you ask people, the more things that you will gain. And another things that very important things that everyone should consider, especially when you want to apply for FRGS grant, if there is any workshop, okay, how to win um, uh, FRGS proposal, okay, workshop on how to write FRGS proposal. If they find any workshop like that, please attend the workshop. Okay, not one or two. If there any from any institution, you might be a staff from UITM. Okay, for example, you want to apply a grant, FRGS grant. If you can attend any workshop from other university, for example, UPM is offering another workshop on FRGS, please go ahead. If you have the opportunity, please attend the workshop because different university will give you different tips. Again, these tips is actually very, very important. Okay, from my experience, right, 4 years involving in getting this FRGS grant, right, I can see that every year there is a keyword. Okay, every year there is a keyword that they are focusing on when they want to give you the research. Okay, for example, when in 2019, the focusing was they are focusing on the youth. Okay, do your research related to the youth, and then the following year they said if you do research related to mental health, chances for you to get the grant is much more higher and etc. And if I'm not mistaken, there is 1 year they say if you're focusing your research on B40, you might get the grant. Okay, so every year they will have a specific field, a specific interest or specific keyword that you have to follow. So don't ever stop attending any workshop related on how to write a grant proposal. Okay, and other than that, you can ask anybody who already got the FRGS grant or whatever, any other grant, please don't be shy to ask them because that is very, very important. I love this Chinese proverb said, he who asks a question remains a fool for only 5 minutes, but he who does not ask remains a fool forever. So never shy, keep on asking people, go to any workshop that related to the grant so that the chances for you to get the grant is much more higher. Okay, my tips number 3 is get the right partners. Okay, as a your core researcher, this is very, very important. Okay, make sure the teams that you create for doing the research is the one that can contribute to the research. Bukan kawan baik, bukan BFF, bukan kakak saudara, makcik saudara, no. Okay, everyone in the team must contribute something. So all the expertise you must use, okay, so that you can come up with a clear and better proposal. Okay, my tips number 4, consider your audience. Okay, what I'm meaning by audience here is actually the panel of reviewer of the grant. Okay, yes, most of the panel, not most of the, all the panels, the review panel for all the grants, contohnya panel reviewer untuk FRGS, they are very smart people. But the thing is, they are also busy. Okay, so they don't have time to read a complicated proposal. Okay, it's good for you when you want to write your proposal, write something that clearly stated, specific aims, well-defined criteria, and etc. Don't make it so complicated just to show that you have a bombastic proposal. No, usually it won't work that way. Try to come up with a proposal that's something very short and simple and very straight to the point. That is very, very important. Okay, this is another tips that I want to give you. This is actually an example of research framework. This is not actual study. This is not actual my research framework that I use, but I just want to give you an example. Usually, panel of review, they prefer things like this in their methodology so that they can see a clear picture, the overall picture of the study. As I mentioned to you, they have no time to digest all the things in your methodology, the writing, right? So come up with an interesting, okay, a research framework or etc. so that when the panel look at this, they will understand the flow of your study. Okay, gunalah warna-warna, gambar-gambar yang cantik so that we can attract them. Okay, why not, right? Okay, tips number 5, get your proposal reviewed internally. Okay, this is very important. And if your organization, your university have this mock internal funding panels, expertise, and etc., you can take advantage of it. Okay, all their comments is actually valuable. Please consider all the comments. Okay, if you don't have this kind of expertise or internal funding panels, what you can do is you get your opinions from a mentor or a senior colleague. This is also very important so that sometimes we overlook or underlook certain things in our proposal. So make sure you get opinion from others, especially expert on the field. And next is ask your peer group, okay, your friend or anyone, read the proposal. Okay, make sure these people never involved in the research. Okay, sometimes if they can understand your proposal clearly, then only the reviewer also will understand your proposal. Okay, so even if your friend couldn't understand what you're writing in the proposal, so you don't expect that the reviewer going to understand. So that's why these 3 stages is very important in writing a grant application. Okay, the next tips is actually do the final checks. Okay, simple things. Okay, spelling mistake, using the different terms, using not specified, stick to one format, and things like this is actually, it's not a big deal. It looks like it's not a big deal, but actually it's actually something that might annoy your reviewer. Okay, if you feel annoying looking at your proposal, definitely the chances for you to get the grant is very low. So make sure you double check, do the proofread, check the Grammarly and everything before you submit your proposal. Okay, my tips number 7 is also very important. Practice integrity in research. Okay, please, when we do the research, this is something that we want the berkat. Okay, we want the blessing from our God, right? So better do something yang that genuine integrity. Okay, practice the integrity in research. Don't simply copy paste other people research. Okay, if you want, for example, if you want to, not to say copy, if you want to refer somebody as proposal, for example, you look at my proposal, you're interested with my methodology, okay, and then you want to do something similar to my study, the first thing, go and ask them, ask the permission from them that you want to use their proposal, etc. Okay, and the next part is very good for you if you can add that person as your co-research team, because you're using the expertise of that person, okay, in your proposal writing. So that person supposed to be in your research. So use them or make them as your research co-team, your co-researchers. Okay, so always practice integrity in your research. And my last tips, which is the most important tips, is never give up and keep on trying. Okay, keep on trying. Okay, keep on trying, never give up. Okay, because our greatest weakness lies in giving up. Okay, lagi you tak cuba, maksudnya you kalah. Tetapi kalau you cuba tak dapat, bermaksud you belum kalah lagi. You masih dalam proses untuk dapatkan grant tu. So keep on try and never ever give up. Okay, this is an example lah. Okay, sort of I believe that might be a motivation for you. I tried 4 times. I have my friends tried 6 times. Okay, 7 times pun tak dapat lagi FRGS. So my advice is jangan give up. Teruskan usaha. If you might your rezeki is not under FRGS, try for other grants. Okay, international grants, internal grants, industrial grants, okay, dan sebagainya, so that your rezeki might be there, okay, but never give up and keep on trying. Okay, so this is another things that I want to share with you guys, as I'm one of the technical working group of this nutrition research priority. This is a book, okay, published for 12 Malaysia Plan and Nutrition Research Priorities in Malaysia. So you can download this book for free. So why I want to share with you about this book here is actually there is a different research priority area in this book. Okay, so since this webinar is focusing on research priority area 3 and also research area 4, so I would like to explain a bit about this. Okay, so under the research priority area 3, we can see that there is the main title of this RPA is Life Course Approach to Food Intake and Dietary Practice, right? So we have A, B, C, and D. We have 4 different cluster under this RPA. Okay, the first one, we can see that the first one is to determinants of food intake and dietary practice of various age group. And the B is to determine the health outcomes of food intake and dietary practice. Okay, it's all about food intake and dietary practice, right? And number 3 is on develop effective strategy or intervention. And number 4 is to improve the assessment methodology of food intake and dietary practice. Okay, so why these things is here is actually this can be a good reference for those who want to do their research proposal. Okay, for example, if you have no idea nak buat research pasal apa, nak buat pasal ni, orang nak buat pasal sugar sweetened beverage, orang nak buat, everything orang nak buat. So you can refer to this NRP to see what are the research area that specifically we need in Malaysia. Okay, so you can start from this A, B, C, D cluster, then you can go to the subcluster. For example, under the improve the assessment methodology of food intake and dietary practice, we can see that you can focus on the improvement in methods, tools, or instrument assessment of food intake. Okay, or else you can see on the dietary practice. What are the tools that we can use to measure the dietary practice, for example? So these are the things that you can focus. Okay, if you look further in the book, right, you can see that there is one part is labeled as research or data gaps. Okay, and needs and rationale. So you can see that what is currently lacking in our nutrition research in Malaysia. Okay, for example, to identify the determinants of food intake and dietary practice of various age group is the purpose, right? Okay, you can see that currently what are the research gap, what is lacking in our country. Okay, even though there is a studies on personal and environmental factor on diet quantity, but the information is restricted only to certain aspect of personal and environment. So we can see clearly the research gap here. You tak payah nak pergi cari buat literature review dekat Malaysia macam mana, because the thing is already here. Okay, in the NRP book. Okay, and they also even give you the suggested research topics. Okay, for example, you can focus your research on the effect of personal and environmental factors on diet quantity. Okay, or else you can focus on the effect of personal and environmental factor related to the diet quality. Okay, diet quantity is different, diet quality is another field, right? Or else you can talk about the effect of emergency situation. Okay, what we do in terms of the effect to diet quantity and quality. Contohnya banjir, epidemic, infectious disease and everything. So even these 3 suggested research topic pun it's a broad, it's masih besar yang you boleh fokuskan lagi. If you want to apply for FRGS, try to identify what are the fundamental things that you can do research based on these suggested research topics. Okay, if I'm not mistaken, I difahamkan panel reviewer untuk FRGS or even other grant in Malaysia, usually mereka akan refer kepada NRP. For example, if you come up with one title, they will see adakah the title that you propose related to any research priority area under the NRP. So if you ask me, the best way is you start with your research idea daripada NRP. Bukan dah siap proposal baru refer kepada NRP. Okay. So this is another things that quite interesting lah. I feel under the purpose number 3, number 4, to improve the assessment methodology of food intake and dietary practice. Okay, we already know that kita dah ada 24 hours diet recall, we already have FFQ for children, and then for example FFQ specifically for high calcium ataupun hypertensive, we have different types of FFQ. But yet we can see that these instruments are not validated properly, for example. So come up, develop or adoption or modification of validation of method, tools, instruments to assess a food intake also can be your research scope. Okay, for example, if I want to develop a FFQ for sugar sweetened beverages of adolescents in Malaysia, okay, my first step for my fundamental, I think the first thing that I have to do is I have to list out what are the foods that comes under the SSB, okay, in Malaysia. Okay, the sugar sweetened beverages might not be same apa yang kita minum di Malaysia compared to in Australia or in America, in UK, in Singapore. So if we can come out the list of food, okay, only the food items can be listed in the FFQ for SSB for adolescent, that is also considered as fundamental. So that is one example that I can give you. I believe that you all boleh fikirkan sendiri, think about what are the things that we can explore based on this NRP. Okay, so the next research priority area is number 4. RPA number 4 is on the nutritional deficiencies and excesses. So they have two scope here. The number 1 is to develop and strengthen the epidemiological and clinical understanding, basically focusing on macro and micronutrient status and the health outcomes. Okay, and number 2, to develop and evaluate appropriate studies and intervention strategies related to this macro and micronutrient. Okay, so this one also you can refer to the NRP books and explore more so that you can come up with your own idea on what kind of research you can do. So with that, I will end my presentation. If you have any question, I'll be pleased to answer them. So thank you for your attention.
Right. Thank you very much, Dr. Siti Sabaria, for your valuable insights and knowledge on this area of expertise. Right. So now I would like to actually open up for the Q&A sessions. Any questions so far? Okay, I guess because you're the first speaker, so people are just getting warmed up and, you know, coming up with their question. However, I do find that it was such a very insightful sharing from your side. And I'm actually very interested in all the tips that you have shared just now, focusing into a very important tip about research integrity. Now, having said that, there are a lot of young researchers with us here now. I'm sure there's a lot of professors and all that, but yes, there are young researchers coming around this area, and we as lecturers ourselves face this issue or scenario sometimes, right? So when we write a grant, or even, you know, when we want to try to venture into a new field, say one person may not be, the knowledge that we have is just hands full. So sometimes we'll be very interested to venture into something new, and that's nothing wrong actually. We want to use, we want to get used to, venture into something new and get to know something new, or maybe apply a new concept or method. Hence, what usually happens is we tend to refer to other people's proposals or methods or frameworks, or maybe even their ideas, right? Anyway, this is a very, I would say, this is research to share ideas and, work together. But the question comes up with how much should we actually, what we call that, what would be the word, Dr. Siti? How would we actually complement this person, or maybe should we like include this person in our research, or maybe even cite this person? So how should we as a researcher maintain our integrity and professionalism when it comes to using up other people's ideas, or maybe frameworks, or and stuff like that?
Okay, thank you, Dr. Nalina, for the questions. They're very interesting. Basically, when talking about integrity and getting other people's, using other people's idea and everything, it's actually about yourself. Okay, you should know your limit. Okay, if you 95% you exactly copy exactly the methodology from other people without their consent, okay, that's considered menirulah 100%. That is not supposed to happen. Okay, we researcher, we supposed to be more professionals. Okay, that's why I say, as I mentioned earlier, if you are interested, or you feel that you're interested in the method used by other people, or you like that objective and things like that, that you want to do similar, not exactly same, I'm talking about want to do something similar to the study, the first thing you need to ask that person. Okay, you must ask their permission that you want to use it, you want to refer to the method, dan janganlah tiru 100%. Kalau boleh, perbaiki, okay, make it better. Okay, number two is good if you can add that person as your research team. Definitely, of course, you use their expertise, right? So it's good for you if you can add that person as your research team. I think that yeah, definitely these are the two things lah that we can practice if you really want to practice integrity in doing research.
All right. Thank you, Dr. Siti. Are there any questions? All right. No, anyway, thank you very much, Dr. Siti, on your insightful sharings. All right. Having said that, I think we shall move to our next speaker. Again, thank you very much, Dr. Siti, for your insightful sharings. Okay. Now we'll move on to our next speaker for today, which is Associate Professor Dr. Nurmah Jusso. All right. Associate Dr. Nurmah Jusso is an associate professor in sports and nutrition faculty in the Sports Science Coaching University Pendidikan Sultan Idris. Now, Dr. Nurmah Jusso had obtained her PhD in sports nutrition from the University of London, UK, and prior to that, she had obtained her Masters of Science in Food Biotechnology in University Putra, Malaysia. And before that, she obtained her Bachelor's of Sciences in Nutrition Sciences, actually, in University of Arizona, US. Now, Dr. Nurmah Jusso has got 22 years of experience as a university lecturer. She has been appointed as the panel for academic program, Academic Kejurulatihan Malaysia, appointed as a speaker in Nutrition Talk for various agencies, and an assessor for the Malaysian Qualification Agency, MQA. Now, some of her research work area would be nutrition knowledge and eating behavior of adolescent athletes in Malaysia, hydration, thirst, and fluid balance in resting and exercising individuals, relationship between hydration status, hydration knowledge, and fluid intake behavior among school athletes of selected schools, The effectiveness of cognitive behavior therapy, diet and physical exercises, and body image improvement of overweight teachers, and also a framework on improving eating habits and physical activity engagement through health behavior adherence. And she has collaborative works with University Pertahanan Nasional Malaysia and University Science Malaysia. All right. Having introduced to you our distinguished speaker today, I would like to invite Associate Professor Dr. Nurmah Jusuf to share her insights. Welcome, Doctor.
Okay, thank you, Dr. Nalina, for your kind introduction. First, let me share my slide. Yeah. I still cannot share my slide because right. Okay, so I think everybody can see my slides now. Okay, all right. Assalamualaikum and a very good morning to all audience here in the WebEx and I believe in the FB as well. So thank you to KKM and UITM for inviting me to share my, some experience in terms of the, what we call it, the application of the research grant. Okay, so this morning, I'd like to share some of, actually some insights and also tips on how I won the FRGS grant. So similar to Dr. Siti just now, actually this is my first grant, FRGS grant that I won as a lead, or what we call it the principal investigator, the PI. So the topics for the FRGS grant is actually on the improving eating habits and physical activity engagement, right, through health behavior adherence framework among Malaysian adults. So actually, when we call it FRGS, actually we want it to be, the study is to be fundamental. So the one that we really need to look at is actually the output, or what we call it, some kind of models, the new idea, something like that. So this is the topic that actually I won in, I was awarded the FRGS in 2021. It is similar with the city just now. Right, before we proceed to further, I would like to introduce my research team for this project. So we have here Associate Prof. Dr. Nelvianti from my faculty, Sports Science and Coaching. She's an expert in sports psychology. Because my projects deal with some part of what we call it the behaviors, so it involves some psychological part of the healthy behavior. And then next, we also have Dr. Ruaiba Yazani, who is the expert in exercise physiology, also from UPSI. And then we have another one, another sports psychology, Dr. Nur Silawati. Then next, Dr. Nurul Fadila, who is a sports nutritionist, who happens to be our next speaker later. And then the last one is Dr. Azima Ahmad from UPNM. She's a sports nutritionist as well. So Dr. Azima is actually my ex-PhD student. So I extend the invitation to her just, just to maintain the networking, sort of like, because she's also in the same expertise, right? So she can help a lot in my project. So basically that's all. I utilize the maximum numbers, for the, we call it the quota for the research team. So altogether we have 6 in the team, right? So for the knowledge sharing for today, actually, I will talk a little bit on the rationale and justification of this study. Next, just a little bit on the experience on the application. Some tips are probably in terms of how to write a good proposal, right? And then next some challenges, especially in the resource management and also research process. And progress of the study and some tips or advice. I believe that Dr. Siti has covered actually most of the tips, are very useful tips how to win the research grant, especially the FRGS. But I will add on some some more tips, just to help young researchers or other researchers who actually are interested to apply for the grant. And then the last one is on the translation of the research findings into the nutrition policies, especially the NRP. Okay, so let's move to the first part of the presentation, which is the rationale and justification of the project. The first, the infographic that I presented here is the main issues why I came up with the idea of the project. So I believe that everybody is familiar with this infographic on the NHMS 2019 on the NCDs, yeah. So if you can see there, it's not. I just would like to focus, on the recommendation based on this statistic or the figures. There are some recommendation being given by the KKM how to combat NCDs. So because these recommendations are actually related to my project, if you can see that, for example, to combat NCDs, you need to eat a healthy diet, maintain a healthy weight, do exercise regularly, sort of, so on and so forth. Okay, for the diabetes in Malaysia, it's quite similar to the, the recommendation is also similar to the one that been given there for the overall NCTs. So if we can see that diabetes in Malaysia, we have, I think, among the highest in Southeast Asia. So from the figure, we can see that 1 in 5 adults in Malaysia actually have diabetes. So equivalent to 3.9 million people. It's quite, it's not pretty alarming, but it's very alarming figures. Every year we have like a increasing trend of the cases. All right, another one, obesity or overweight also follow the similar trend. And then what are the recommendations that being given? So it's similar to the diabetes and hypertension. So like eat a healthy diet, be physically active, stop smoking and all. Right? And then this is very interesting. It was written in quite small letters, but I think it's very interesting part because it shows the adherence to the recommendation. So it says that why obesity increased above 50% in Malaysia. So there is a very small statement there. 95% did not actually consume fruits and vegetables, sufficient fruits and vegetables, right? So following that, in terms of healthy diet, now we go to the some statistic on the physically active lifestyle. So from the data, are we active enough? So the data shows that we are not actually lead a healthy, active lifestyle because 1 in 4 adults in Malaysia are not really physically active. So what are the recommendations there? Similar to the one that recommended by the WHO. It's about like you have to really exercise about 100, 150 minutes, moderate intensity per week. So equivalent to at least you have to, do some activity about 30 minutes a day. something like that. And then the last one is on the health literacy. I just want to focus on the first one to understand health risk factor and practice healthy lifestyle. So from the data, it shows that 1 in 3 adults actually have low literacy. So those are the problems that actually lead to our proposal, because in terms of consequences of the NCDs, we can see that NCD cause a lot of what we call it in terms of economy. So we have estimated loss of about 0.65% of GDP. So these are the factors that cause the loss. First one is premature death, so due to CVDs, diabetes, and cancer. And you can see that CVDs contributed the highest for the premature death. Then in terms of absenteeism, so we had a quite large loss of about 2.6 billion, and the presenteeism about 6.2 billion, right? So absenteeism meaning that the employee absent from work because of the illness, and for the presenteeism, actually the employee actually they present at work, but they are not working to full capacity due to the illness. So what we call it is such a big numbers, a high numbers of NCDs and such a big loss to our economy. So what have been done so far? I think we are very familiar with all the initiative done by our, government. For example, we have KKM. They have like Pinggan Siap Malaysia, Suku-Suku Separuh, right? And then last year's KKM already introduced, I think, a new version of food guide pyramid, replacing the old one in 2010. So it is a long initiative being done by the KKM. Similarly, likewise, for example, KBS, they have done a lot of sort of like campaign projects and programs to encourage people to get active, be physically active. For example, Hari Sukan Malaysia, Hari Sukan Negara, and at the school level, they have policies on one murid, one sukan, something like that, at the Fit Malaysia. So I believe that the government, they have done quite a lot of incentive, what we call it, initiative and incentive to combat the problem, the issues of NCDs and the economic loss. But despite that, why the statistic keep increasing each year? Okay? Because, for example, some study shows that, as Rinsha in 2018, they found that obese individuals have low knowledge about food nutrition and physical activity. And some other research done outside Malaysia. Surprisingly, from this study, for example, of High and Alzheimer, they did a study in I think Middle East. They found that over 60% of university students practice unhealthy dietary habits and physically inactive. So this university student who's supposed to lead a physically active lifestyle, but when they did the survey, the result shows otherwise, contrast. So what I think is that even though we have the educational intervention, have been carried out to address all those problems related to NCDs, but somehow we can see that in terms of its effectiveness is quite equivocal. So knowledge alone actually did not translate to the healthy eating and exercise, or what we call it healthy behavior. So from there are some other determinants or the factors that may explain why this particular group of people actually do not really adhere, to the healthy lifestyle, such as probably the belief and perception, motivation, you know. So from there, I came up with this idea of, studying what are the framework that can explain the inadherence, or why the population actually did not follow the recommendation despite all the intervention given to them. So I choose to use the HBM, or we call it health belief model, because this model is used to predict individual response and then change in their behavior, specifically to prevent disease. So state score of the HBM actually, we have a perceived susceptibility, is where an individual assess whether their risk of getting a disease or condition. And then the perceived severity, when the individual actually perceive of the seriousness and the potential consequences of the disease. And then another one is the perceived benefit. So when the individual believe that, when they practice the healthy behavior, they will reduce the risk of the disease or the impact of the disease. And then the negative part is the barrier. Perceived barrier is the something that individuals think that difficulties, why they don't really want to practice the healthy behavior. And then the cue to action is the internal or external motivation that promotes the desired behavior. And the last one is the self-efficacy, meaning that the individual, they believe about their capabilities to whether to perform successfully on the new health behavior. So this is the model I developed for this study actually. So we have the just now we have the perceived susceptibility and perceived severity, which make up the threats to unhealthy behavior. So this is a good one, a positive aspect of the what we call it, idea. Okay, and then we have also the perceived benefits of healthy eating and physical activity, and then minus the barrier. So if we the perceived benefit is we call it is higher compared to the barriers, then we can actually perform the healthy behavior. So from there, the cues to action, and then I also include some of the demographic factors into it, just to see, among different age group, among different genders, also ethnicity, and then some of the socioeconomic factors, such as, the location, or whether they are in the urban or rural or suburban area, wages, the marital status and all. So we include that in this model to see whether, they adhere to healthy eating and physical activity. Basically, that is the output that I hope, to get from this project. Right? And then moving forward, so this project actually is a conceptual framework. Okay, because it's FRGS, so we need to establish or publish some kind of framework model or some kind of new idea. So hopefully this framework will allow the educators and the policymakers to actually characterize some of the fundamental aspect of the health behavior adherence, meaning that whether we know that something is, contoh we know that eating sugary drink is not good for our health, but whether we adhere to the concept or not, that it depends on multiple factors. So that is hopefully I can get that kind of conceptual framework at the end of the study. Then from there, probably, in other research grant or, other studies, you can design sort of like innovative and effective intervention to overcome this health issue. Okay. All right. That's basically that's that's a little bit about the background of the project that I won in 2021. So next is the experience. Okay, it's not that what we call it. The experience on the FRGS application actually is quite similar to what Dr. Siti mentioned just now. If you want to really, succeed in your application, at least you have to prepare early. Okay, that's from my experience, at least 6 months before the announcement of the application. Why? Because 6 months is the time that we actually can think through, and then we get the suitable, the appropriate team members to contribute to the idea of developing the proposal. And then coincidentally, what we call during the proposal application, I was appointed as what we call it, internal reviewer for the grant application, because here at UPSI, sorry, those who appointed as associate professor and above, they are actually appointed by RMIC to review the grant internally. So during the process, actually, we were given sort of like a training sort of tips by inviting the panel of experts from the KPT to share their insights and tips on how to evaluate the grant. So actually, I've got very Alhamdulillah, I've got like the first-hand information from the panel of experts at KPT, okay, about how to evaluate, and at the same time I got the idea on how to write the proposal in a way that they really want to approve as of how to approve the application. Okay, and then similarly you need to attend all the sharing session about the grant application, usually organized by faculty or your organization, MIC. Okay, and then during the application you have to check the grant scheme guideline, because this one also covered by Dr. Siti just now. So because every year they have like they change some of the terms, some of the guideline, the requirements. And then next is the most important thing is you need to recruit a well-balanced research team. So you have to have like seniors member, sort of like it's suggested by the panel of experts at the KPT. So you have the young one and the senior one, and then in the middle, from the various background that can actually contribute to your research. Okay, this one also I learned from my previous application, which was rejected based on one reason. The panel said my application was not successful because my team composition is not appropriate. All were last time in 2018, if I'm not mistaken, all the team members were like a new lecturer, like not really experienced researchers. So he just, reject the application based on that particular point, because, KPT, every year they receive thousands and thousands of applications. So the assessor only needs to find one little mistake or one weakness not to consider your application. So when I said that, meaning you have to submit a perfect, sort of like a perfect application. Okay, and then you have to pay attention to all details in the application form. So I outline some of the examples here, like for the title, when it says fundamental, then you really need to have the necessary keywords that reflects the fundamental aspect of the research, and it must be sort of like catchy. Okay. And the next is the executive summary. This is the most important part of the application, because as I mentioned before, the assessor at a KPT level, they don't really have much time, to read through the complete application. The one that they focus on is your executive summary. So make sure that your executive summary contains all the information that they need to know, in, if possible, in layman term. So do not be too complicated, sort of like very difficult for them to understand your project. So these are the things that problem statement, aims, methodology, significance of the study, and the most important thing is what is your research output. And you need to mention that in the executive summary. And then, coming on the other, there's a sort of like problem statement, rationale, and objective must be aligned to each other. Methodology, of course, you need to address the objective of the study and must be written in clear and detailed explanation, right? And then this is very important as well in terms of budget. So your budget must in line with the methodology, meaning that when you mention that in your methodology that you need to have the qualitative interviews, workshop 1, 2, and 3, then you have to transfer that in your budget. So the one that activities that is not in your methodology, when you put that in your budget, then they will just reject your application based on that. Okay, because they have like thousands of proposal, so they just need to find one little weakness, which one is need to be put aside or not to be considered. Okay. And then in terms of if you need to use some equipment in your project, then it must be readily available, because the FRGS, they don't allow you to buy the equipment. So they assume that you already have the equipment. Otherwise, if you don't have the equipment that you need, then you have to look at other place, and you probably is the best is to make the persons at the institution as your co-researcher, so that you can use the the infrastructure, the equipment at at the institution. And then of course the realistic timeline. Okay, this one not to be too highly ambitious on the um, how to get your outcome or your output, must be realistic. Okay. And then the one thing, based on my experience as the internal assessor for the FRGS for UPSI, the additional info that the funder needs, actually, for example, pattern search, research collaborator, they don't really make it compulsory. But if you have that, it's a bonus point for you. So please don't ignore this part, because they have like sort of like additional bonus point if you have that document in your proposal. Okay. So the one that is very difficult to get is actually the letter of intent for the research collaborator, because not all of the agencies would like to write the LOI for us, unless they really confident that our project can actually contribute, to their agencies or to their benefit. Okay. All right. And then in terms of challenges, it's quite similar, because when we apply for this grant, actually in 2020, 2021 is still we still have COVID around, and then of course our work is a bit slower because of the MCO and everything. So in terms of resource management, I have quite difficulties to recruit potential GRAs. And then, of course, one more thing is the budget underspending, because we don't have much activity at the start of the project. So around early 2022, then we start moving. So it's a budget underspending there, quite a lot. It's not spent. And then in terms of the research process itself, it's quite similar because how to recruit the respondent in terms of active application is way behind the schedule. The panel expert for questionnaire. So if you look at the progress of the study, so this is my what we call it, the flowchart of the research process. So my project is consists of quantity and qualitative part. So it's quite slow at the at the start of the project actually in terms of quantitative data collection. So from there, I think I just finished up to 40% up to now. So we still not complete the data collection for phase 1. Supposed to finish around April, but now it's already August. So we are way behind the schedule, but I'll try to catch up because now as the MCO is lifted, so we can go traveling to get the data face to face and everything. So hopefully by September next year, we're able to finish that successfully. Okay. So for some advice and tips, it's quite similar. I think what we call it, you have to always alert on the notification from your funder if you apply for FRGS or other grants. Because at this point, probably mentoring system is very important because starting this year, UPSI, they had like a mentoring system. So the one that already won the FRGS are appointed as a mentor for the new applicants, and the mentor actually get paid for the consultation. So it's a bit of motivation. Okay. And then, of course, well-balanced team composition, as I mentioned before. Attend all sharing session, panel of experts. If possible, attend all of them because you will get lots of tips, which will be, very useful for your application. And follow exactly the guideline and instruction. And then please don't ignore any recommendation of what we call it, the extra info that they need, because that will be your bonus point that will make your proposal stand out from the rest. Okay. And then the last one, of course, everybody will give this kind of what we call advice, right? So don't give up. Perseverance is the key to success. And then keep on improving on your writing. Actually, it's easier said than done, right? Because people always say don't give up. But from my experience, this is actually my fourth time apply for the FRGS, and then I did not only one FRGS, but last year 2020 I got three. Okay, 3 FRGS at the same time, Alhamdulillah. So the first, the one that I'm as the principal investigator is this project. Then another project that we want is with Dr. Nurul Fadila, who will be our next speaker. And then another one, I collaborate with my colleague in USM. So altogether, 3 FRGS in 2021. So I guess this is like, rezeki lah, kita kata kan, rezeki. So just try out, we don't know our rezeki macam mana, so keep on trying. Okay. All right, and the last one is just how these research findings actually can be translated into the nutrition policy. So my project is really on follow the related to the NRP of 2016-2020, which aims to achieve optimal nutritional well-being of Malaysia. So these are the things that I hope the outcome of the project will benefit the health educator in terms of intervention strategies, which integrate holistic component, not only nutrition and physical activity, but the new one coming in the framework is the psychological aspect of the healthy behavior. Right? And the government, of course, the corporate sectors, they need to reduce the economic and the social burden due to NCDs. And lastly, for the healthy well-being as prosperous citizens or nation. Right? So with that, I end my presentation. Thank you for listening. Thank you.
All right. Thank you very much, Dr. Nurma, for that insightful sharing. Yeah, we shall open to the question and answer sessions now. Any questions? Oh, guys, I guess our participants are still warming up. Actually, there's an overwhelming input about how to write the grant. So I guess everyone is just processing about all the knowledge and tips in their head. But however, I think it was very great that you actually shared the application steps and also the parts in the form showing everybody actually what is actually needed in the FRGS form, right? So what needs to enter into there? What is the criteria and stuff like that? I think that's very great, and thank you for sharing that. Um, just maybe you could share with us after getting the FRGS grant, the first thing that we should actually do is, requite a GRA, because that is one of the important output that is needed for the FRGS grant, especially within the first 6 months or 1 year, right? So
Right.
what we actually realized that a few of us here that, despite advertising that we need a GRA and, we have got a stipend and stuff like that, it's so difficult to recruit one lately. So can you maybe share with us some suggestions on how we can easily recruit a GRA?
All right. Thank you, Dr. Nalina. Actually, one thing that I thought at that time, actually, to get to know some of our undergrad students who are potentially become our GRA. But at that time, because the class, was conducted online, so we really couldn't get to know our student. So I guess because my GRA, finally I got my GRA is from my ed student, my undergraduate student. So we actually I asked around at the faculty, get the CVs and everything, get the recommendation from our fellow lecturers at the faculty, and from there I confident that she can actually help me in the project. So I guess besides, I also get some help from my colleague at other universities, but nothing came up. So I think it's very difficult at that time. But now, hopefully, I guess because the class will be conducted face to face later on, so we'll get to know our student better, so we can actually pinpoint who would be our potential, GRA for our project if we apply one. Okay, I think that's all for my sharing. Hopefully, it answers your question.
Yes, and also a little bit on your research. Actually, I just read here that you actually did a survey of awareness of level of communicable and non-communicable disease awareness level, yeah, among the Sultan Idris Education University students. So this is actually a very interesting study because we actually want to know how much knowledge and also adherence our young adults have. Is there preliminary results on this just to know what is it? What's the statistics like? How many of them actually adhere to it? And what do you think is the main barrier of our higher education institute students to actually follow certain guidelines or advice?
All right. For that study, essentially, the grant was awarded because we have to write a book on we call it a finishing school program for our student. So the result shows that we have like we asked them about awareness on the obesity, diabetes, hypertension, CVDs, and a mental illness. Okay, one part of the mental illness. So surprisingly, the awareness is not that good. I'm not sure because probably the data collection was conducted during the COVID. So I'm not sure whether they really aware of the information available around them. So it's quite what we call it frustrating actually to look at the statistic because university students supposedly they have what we predict they should have a higher level of awareness compared to other population, right? So basically that's it lah for the result at the moment.
Right. Thank you. Thank you. Thank you so much again, Dr. Nurma, for your insightful sharings here. That was really very informative. All right. Thank you again. So now, a few housekeeping notes for now. This webinar is being recorded. All participants are automatically muted by the webinar administration. Drop your questions for the speaker at the Q&A box, and links for NRP documents and feedback form for your e-certificates will be shared at the end of the webinar. Having said so, I think we have been seated for quite some time, so I guess we'll go for a 3 minutes break and see you soon. All right, hello and good morning. Welcome back to our webinar. All right, so let's move on to our next speaker for today, which is Dr. Nurul Fadilah binti Abdullah. All right, now Dr. Nurul Fadilah Abdullah is the head of department from the Health Science Department, in the University of Pendidikan Sultan Idris. Dr. Fadila obtained her PhD in sports nutrition from the University of Birmingham. Prior to that, she had her master's in nutrition from USM and her bachelor's in nutrition from UKM. Her areas of expertise includes nutrition and also sports nutrition. Some of her research would include improving eating habits and physical activity engagement through health behavior adherence framework among Malaysian adults, elucidation of metabolic risk biomarkers in overweight and its modulation by high-intensity interval training intervention, appetite responses, energy intake, and exercise substrate utilization in overweight and obese population, and also something on COVID, proposing a dietary pattern in increasing mental health during COVID-19 lockdown among university students in Malaysia. Now, Dr. Nurul Fadila is also a consultant in the field-based physiological testing and nutrition literacy for women social footballer and coaches at grassroots level. And also, she's also a consultant in the Ujian Physiology Athlete MTBC Games Hanoi 2022. All right, having introduced you to our speaker today, hence I actually welcome Dr. Nurul Fadila to share with us some of her expertise. Welcome,
Right.
Doctor.
Thank you so much, Dr. Nalina. Thank you. So let me share my slide first. Is it my voice okay today? Right. So yes. All right. So first of all, thank you for inviting me to this webinar to Nutrition Division that collaborated with UITM. So actually, it's comparing to the other two panels. I'm not quite young in terms of what we call in the research area. Actually, if you look at my CV, but I was just finished my PhD in 2019, whereby those two panels already have a lot of experience. Anyhow, I was maybe I can share a bit what is on the part of a young researcher is on that kind of area. Okay, so as Dr. Dormasik mentioned just now, both of us received the grant from FRGS last year, 2021. So my grant is entitled Investigating the Role of Nutrients, Exercise Timing in Modulating Appetite Response, Energy Intake, and Exercise Substrate Utilization in Overweight or obese populations. Okay. So before we go further, so would love to introduce our team. So this grant is led by me, Dr. Nurul, and then we have Dr. Norma, our panel just now from UPSI, and we have Associate Professor Dr. Nit Shanita from UKM, and we have Dr. Nur Hazira, also from UPSI. I'm one of my colleagues from UPM, Dr. Nora Shikins, and our talent is Muhammad Aizat, currently a student in UPSI, master student. So the rationale and justification of the research. So how I came up with the research. So first of all, of course, we have a problem. Okay, so from the recent National Health Mobility Survey 2019 reported the increasing of overweight and obesity. So the first, maybe a tips also for the grant. The first things when we want to produce or have an idea, we have to know what really the problem for of our community or our population. So always go to the national survey, what we actually have the problem. So this is what I did. Okay, so we have an increasing prevalence in overweight and obesity, and also overweight and obesity is something that familiar with me. I've been done a few research in this area. So this is kind of things that I'm expert to do. So that's why I proceed with this idea. So, and then why we have to overcome this, because of the overweight and obesity have been associated with increased numbers of NCDs, such as the hypertension, diabetics, and even a cancer. And recently, we have seen that obesity been identified as a risk factor for the severity of illness for COVID-19 and also the death rates of COVID-19. So it's a worry. It's something that burden our country. So in terms of how we want to propose strategy or to prevent these problems, so I actually go back to the NRP. So to be honest, because I don't realize that we have NRP. So when I have this problem, I went to Nutrition Division. I call them. So I email. I think. So I have this idea of applying a research grant to help with the obesity, etc. And then what actually you need. So that's actually my email to them. So they come up with, they gave me this NRP. So when I see this NRP, they actually have there's a few areas. Okay, so they have area number 5 for overweight and obesity. So interestingly, they already provide you everything, what they actually need, the government basically. Okay, so that caught my interest is the C2, okay, to identify a novel strategy to prevent and manage obesity, something that I always want to do. My passion is to find something, to create something or to suggest something that can help the government to combat or manage a problem for obesity. So they even have a cool stuff too. They suggested a research topic for you. So you don't have to think. You just go there and you find out, oh, what is the research topic that been suggested? So easier because you are suggesting something that what they need rather than a new thing that they actually don't need that. Okay. So so we already know that government needs some things to a new strategy to combat this issue. So from the literature, we always see that nutrition and physical activity being recommended as a treatment or a management for obesity. But rather, what we always see is being introduced independently. But we never see that a strategy that looking on the interaction between these two. Interaction means like if we give him this, the feeding, for example, the feeding, nutrition and exercise, is there anything that related between them? For example, timing, is there any, if we give a feeding timing different time around the exercise, is it gonna give some other benefits or implications to the obesity management or things like that that we didn't see yet. Okay, so go further with the literature. It's actually there's been extensively research been done on the feeding timing around exercise, but they did among young adults, basically active adults, because they wanted to see whether fat metabolism will improve their sport performance. Okay, but clearly, and then it shows clearly that diet can interact with exercise response. Okay, and then this theory is actually relevant to the context of obesity because we want to stimulate the fat metabolism among these populations. So using this theory, we also have another things that we want to see. the appetites. Let's say we modified their feeding timing around exercise. Is it gonna affect their appetite control? Is it they're gonna have a subsequent their intake of energy intake, the subsequent energy intake are going to increase because of that, which is it's not going to be benefits. So, but we don't see that among obesity, overweight population yet. Okay, so that's what interests me. So that's why the impact of such interactions are therefore important to be investigated in obesity, as they may provide insights on how we can optimize the combination of exercise and nutrition in improve the metabolic health among these populations. Okay, so that's the aim of the research, which is to propose to investigate how nutrition timing around exercise can modulate appetite response, subsequent energy intake, exercise substrate utilization, and body composition among overweight and obese adults. Okay, so what we hope that we can get from this research project is to provide insights whether timing of nutrition around exercise can be an important variable when we want to do any implementation program for these groups. Okay, right? Doesn't matter what age they are, in terms to control their intakes and also to for their weight management. Okay, so indirectly, it's going to help them to reduce their weight and reduce the problem of obesity and overweight, and which leads to health costs, decrease the health costs, healthcare costs, and also economic burden to the government. Okay, so what is the challenges that I face? So actually, with this project is still ongoing. Actually, it's a little bit slow because of because when we got the grant is into September 2021. We still we just lifted the MCO. And then, but some of us still working at home, and with the with a very restricted in terms of going to laboratory and etc. So, the progress is a little bit slow for before, but now we are trying to pace up our progress and then to keep up with the milestone that we already have. Okay, so the challenges that we face so far is, first, of course, the recruiting a talent is a very difficult during that time when I received the grants, because of maybe too long with the online classes. We don't know the students, and then in my experience and from the colleagues, as a senior experience, I've been told that we have to recruit a really good talents that not at the end gonna go away or didn't manage to do the project that we have. And also the second is recruiting participants, because this project required them to come to laboratory for some blood sample, giving them some manual on the exercise part and on the everything that require with the body composition measurement and etc. So that's a bit challenging before, but then now we are keeping up with the pace. So hopefully we can manage to complete the study according to the milestone that we already proposed before. Okay, so that's a little bit about my grant or my research projects. Basically, what I did is I find out problems, then the solution, because I think when I came back from to UPSI after my study, we've been told that please conduct a research that benefits to the community. So rather than short sendiri lah. Okay, so that's why when I been asked or being encouraged to apply for the grants, what I did first is I contact the relevant industry or relevant units like KKM, Nutrition Division, and etc. Because I want to understand what actually they want, what they need, the requirements, what actually they need in order to solve the problem, so that I can come out the idea around the need that they already elaborate or have. Okay, so the other two panel actually already shared a very detail on the grant application. So maybe on my part, I'm gonna share a bit what I did actually. Okay, generally what I did. Okay, so for the specifically for the FRGS, okay, there's a few areas that you need to focus in order for your proposal can be go to every stage of the evaluation, because I've been told that by the panel, by the evaluator before, that there's a few phase when they evaluate your proposal. So the first is they're looking on your title. Okay, so because it's fundamental, your title must show a fundamental issue. Okay, you're specific to reflect the fundamental issue. Okay. Right. So, and then and it show a brief and content of your proposal. So that's why you need to put everything that you want actually to do inside your title, but not too long and not too short. Okay. So the first thing they will see is your title. So if you pass your title, you go to the next stage. Okay. So they will read your executive summary. Okay. So this one, in the executive summary must be short and comprehensive enough, that comprise of your problem statements, objective, methodology, a very brief your methodology, but comprise everything that you want to do. What is your expected output and significance of the output? So basically it's actually like you writing abstract for the journals, but rather you don't report any result here, but just then expected output. Okay, so once you they are okay with your summary, then we go to your research background. Okay, so research background is you need to clarify the problem statements that you already mentioned inside your executive summary, because here in the executive summary you only mention like 1 or 2 statements only. So in the background, then you have to clarify more, and then together with your research questions and hypotheses. And then all these things must in line with the government policy. So always refer to the niche that the government wants. Let's say, for example, in our case is the nutrition part. We have NRP, which is very good for us to refer to what actually the agenda is and everything, so that we in line with that agenda. And then we go to objective. Okay, so your objectives must be specific, measurable, achievable, realistic, and also to be achieved within the time frame. Because FRGS is only about 2 to 3 years. Okay, maximum is 3 years project. So make sure your objective can be done, can be achieved within that time frame. Don't be too ambitious by putting very bombastic objective, but cannot be measured and cannot be achieved within the time frame. Okay, and then the most important part is the methodology. Okay, this one you need to be very clear and detailed in terms of description, what you want to do. Like the first panel share, Dr. Siti share that is a very good if you have the the framework that sometimes when we elaborate in the written form is quite difficult to understand or to imagine by the evaluator. So by the framework or the flow charts, it's more easier for them to understand. So easier them to give you marks on this. Okay, so your methodology must inline with your objective, which is every objective that you mentioned earlier is measured in the the methodology that you put is going to measure the objective. Okay. All right. So next is, oh, why I cannot move? Sorry. All right. The expected results. Okay. If you have a new theory that or new finding from your research, you put there. The publications. Okay, it's better for you to put the potential journal that you want to send. Okay, human capital is very important, your PG, the postgraduate student or GRA, and then what is the impact of your research to society, academic, and nations. So you have to look on the broader scope in terms of the impact of your research, not only on the population itself. Of course, we want to help the population, but then please see in the broader scope in terms of the society, economy, and then the nation. What will happen to them? What will they gain from your research finding? And then 7. Okay, this is actually the challenge that for me, especially the young researcher, I would say, even though my age is a bit not young, but then in terms of experience as a researcher or academician, I would say I'm still young. And then the track record and team members, because evaluator really looking on that, of course, they want to give you money. They want to give to someone that they know will be able to finish the grant and able to produce a good result, a good findings. So the track records is very important. So if you like me, are very young, you don't have experience before to applying any grant. Actually, this is my first grant that I got as an academician. So you have to be very clever in terms of playing, put the team members, the composition of team members. Okay, so that you need to have a seniors inside your teams. So these seniors are gonna play a role as your mentor when you in terms of conducting the research. So that's what evaluator will see when you put senior members. Okay, don't be too timid in terms of when you want to invite them to join you. Of course, it's not that easy because you're young and then don't have experience. It's very hard for people to actually believe on you. But then just ask and ask someone that's in line with your interests, so that is she or he gonna help you, gonna really mentoring you. So in my case, I was so lucky enough that Dr. Norma, which is the and then also Associate Professor Dr. Neat, which is my former lecturer when I was in UKM, Sudi to accept my invitation to join the group. And then I also include the other two, Dr. Nur Hazira and Dr. Nora Shikin. Both of them, Dr. Nora Shikin from UPM is the recipient for FRGS 2020 or 2019, if I'm not mistaken. So she also quite young, but then she already received the grant, so it's a value added to me too, because I add someone that already had a grant, have a very good track records. And Dr. Hazira too, been applying the grant for a few times, so have a very good track record in terms of completed many grants. So that's how you need to play with your team members, okay? And then well balanced in terms of the expertise, okay? Of course, you need to find the senior everything, but then still within the expertise that related to your research that you propose, okay? The next is the quality of proposal. Your proposal must be meticulous, use proper language in terms of grammar, spelling, sentence, construction, and then formatting, follow the format that needed by the grant. So for this one, actually, I'm not very good in terms of, I'm not a meticulous person, to be honest, but then for this one, what I did was, I have a few friends that applying the same grant. So what we did within our groups, we let our colleagues to check our proposal. So when that person who not involved with the proposal itself read our proposal and then understand what we want to say, what we actually want to achieve, then for us, I mean, it's good enough. So we believe that evaluator going to understand whatever we wrote inside the proposal. So there's a many ways that you can do, even though you are not senior yet in terms of the grant application, etc. But the thing is, you have to work harder in terms of how you want to make it or make your proposal look a good quality. Okay, if you have senior, if you have a mentor, is more than it's very good that you can go to the mentor and ask the mentor to check on your proposal, etc. Also, I also heard something kind of takut untuk bagi orang baca because nanti curi idea. Might happen, mungkin it's gonna happen, but you know, you can find a correct person lah to read your proposal or to actually check and give feedback on your proposal internally, okay? And then ninth is the budget. Okay, so this is quite difficult for me too because my first time, I'm not really good in terms of budgeting. But then from the talk or the sharing that I went for the application of FRGS, all of them mentioned about you have to very detail and itemize each of the budget. It takes longer for this part because you have to put everything. For example, you want to take a blood sample. So everything that involved in during the procedure of taking blood, you have to put everything from starting of the unit cough swab until how you want to analyze the blood sample. So everything must be there. One by one, with the quotation is better because the regulator can see lah. Actually, you put effort on that. Okay, put the correct item under correct vote, convincing calculations. Don't. That's why it's better to have
Sorry,
quotation.
excuse me, Doctor. Dr.
Yes.
I would just like to alert you that we have about 3 minutes left, yeah?
Okay, almost done. All right, thank you so much, Dr. Nalin. And then tally with the research methodology. So don't put something that you're not gonna use actually, okay? And then the last one is the criteria of FRGS must be novel, cutting edge, and high impact. Okay. So this is the challenges during the application process that I face is because I'm from the experimental person to convert to change my mind from experimental to fundamental is a bit challenging. It take quite some time for me, to be honest, but then you have to work on it, okay? So my title actually been rejected so many times by myself and from the colleagues. So just work from it. And then composition of team members already explained about it, and the collaborations. Because FRGS need us to show that we can, the research can collaborate with agency or any any community or policymakers. So this is quite challenging for young researchers, especially because we are not established yet. Our name is not established. So people are not sure whether they can complete or with you or not. So, but then just try your lucks. Just send out the letter. At least you have the letter of intention that you want to collaborate with that people. Okay. So yes, the challenges, the struggle is real, but then like Dr. Norma mentioned just now, maybe 2021 is my lucky year. I had a baby during that time. I think I gave birth 2 days before I submit the proposal. And then I received 3 grants for the 2021 FRGS, one as a the principal, the other 2 as a members, one from Dr. Norma and the other one from Dr. Nur Hazira. And lucky enough for 2022, the members, as a members, I received another FRGS grant. So so my message or my advice is, even though we are quite young, or you are quite young, not so many experience in terms of the research or grant application, but just try your lucks. Work according to the what needed, and then maybe you gonna have some luck, luck in any way, and then you will receive your grant. So for those who have been trying so many times, keep on trying. Don't ever give up, because you never know when is your luck is gonna be, right? Okay, I think that's all. Thank you, Dr. Nalina, and thank you everyone for listening.
Okay, thank you very much, Dr. Nurul. Thank you for that sharing, and congratulations. So you have about 4 FRGS now in your hands,
Oh yeah.
and one you said you submitted 2 days before you went for delivery. That's
Yes,
exceptional.
it's
Right.
quite dramatic.
Yes, yes. Congratulations and all the best. All right. So we're open for the question and answer session now, and we have a question for you from the audience.
Wow.
Wow. All right. Okay. Anyway, I think this is a very good and also important question here. So someone has actually asked if they actually have a research project or a proposal, right? But it's not related to the nutrition research priority at the moment. Will that particular project or proposal be accepted and also have a high acceptance level in the FRGS?
Thank you for the questions. I think it depends on the project itself also. Whether if it's a very important, or it's going to provide a very insightful findings, it might be considered. But then if you related your project to the NRP, especially, the chances is going to be very high to be accepted. Is my opinion.
Right. Yeah, I do agree with that. And also in one of your slides, just like the others, you went through with us all the areas that we're supposed to pay attention. So maybe you would want to elaborate on what does it mean to have a good track record?
Okay, so this is before I want to apply this grants. So I went to many sharings, like other panel said. Okay, so one of the things that they highlight is to have a good track records, because the evaluator will see whether the proposal that you propose is actually you already kind of in your expertise or not. One thing, and then the track record in terms of, did you completed either grant that you had, or most of the grant is not is still in progress, also not completed within the time frame, that kind of things. And then also basically that's those 2 things that they're gonna see, the track records, under the track record. So it's quite difficult actually to have a very good track record as a young investigator actually. So, but then you play with the member of your groups. Okay, so find someone that have a good track records to mentor you, to cover up you actually, to boost out you as a leader in for the team.
Yeah. Thank you very much for that tips, and I'm sure it's a valuable tip for all our participants listening today. Well, do we have any other questions? All right. Okay, we don't have any other questions, and thank you so much for answering both those questions, and thank you very much for sharing your valuable expertise and knowledge. Right? Thank you. Thank you, Dr.
Thank you
Fadila.
so much.
Right. Okay, so moving on to our next speaker, our next panelist for today, Associate Professor Dr. Lo Su Peng from UPM. All right, now a little bit about Associate Professor Dr. Lo Su Peng. She's an Associate Professor in the Department of Nutrition and Dietetics, Faculty of Medicine and Health Sciences, University Putra, Malaysia. She's currently the coordinator of the postgraduate program in the department. She has been working in UPM for more than 18 years. Her research interests are on micronutrients, especially on iron, folic acid, vitamin D, and in health and diseases among various populations, bioavailability of nutrients, and nutrigenomics. She is currently the member of the editorial board for the Malaysian Journal of Medicine and Health Sciences. Her collaborative research partner includes South Australia Health and Medical Research Institute. So having introduced to you all our distinguished speaker, I now invite Associate Professor Dr. Lo Su Peng to share her knowledge and expertise with us. Welcome, Prof.
I hope everyone can hear me well because I'm currently outside of Klang Valley. So hope everyone can hear me good. Okay.
Yes.
Okay, so today I think I'll be sharing a shorter presentation because I think most of the speaker just now have covered most of the do and don'ts. I don't want to repeat all over again. Okay, so allow me to share screen. Okay, I hope everyone can see the screen. Okay, so this is the same as all the other speakers. I got the FRGS grant in 2021. Okay, so this is on water intake, maybe something that is not so much highlighted, I will assume. Okay, but I will share what are some of the reason and justification for applying for this particular topic, especially maybe some of us might be thinking that this is something like, okay, it's important, but maybe not so important, okay? So basically, we all need water, okay? And I think this is part of something that might be considered, some will consider that as important as nutrients, but some would say, oh, this is not part of the nutrient, okay? The important thing about water is because it affects our system, okay, especially when we know that if we do not get enough of water, then we will say, oh, then there might be some condition that is related to dehydration. So especially maybe urological problem, gastrointestinal problem, okay, and some might even say that some of the neurological problem also might be related, okay. Okay, so the background that I base on this research on is actually looking at the NHMS study. Okay, because I'm actually part of the writers for the Malaysian dietary guidelines for water. Okay, so why I choose this topic, because I'm one of the writer that I find it very frustrating when I want to write the topic on the Malaysian dietary guidelines on water that we don't actually have sufficient data to back us up. A lot of these data are actually coming from overseas. Okay, and so I actually the only water intake data that we have is actually from the NHMS study, which actually asked the people whether they drink enough of more than 6 glasses of water per day. Okay, so this is all the data I think you all might have seen from NHMS 2019 data. Okay, so when we got this thing, so we see that there's a certain percentage of people in Malaysia are not taking enough of water. Okay, and we also see some differences. Okay, maybe like in Putrajaya there's higher percentage, and maybe there's also differences between like rural and urban. Okay, so that's where we wanted to know as well, is there any differences is because of like the location they are in? Is there any other environmental factors that is actually contributing to why they are not taking enough of water? And also these are all reported, right? So this is self-reported. They say I'm taking sufficient of 6 glasses of water per day, but whether this actually translate to good hydration. So because we understand that this is something that is actually going to trigger our thirst mechanism. So if you don't take enough of water, by right you feel thirsty, right? Okay, but does that actually correlate well? So because we can always report we drink enough of water, okay, but does it actually come up with our body telling us we are lacking in water? Okay, so that is also something that we wanted to get from this study. Actually, what is the actual hydration status? Okay, because we know based on the water intake, we have this data from NHMS. Okay, but the actual hydration status data in Malaysia, we might not be having a lot of it. Maybe in the athletes population, we might get some data, because that is a very important parameters or variables that, like for athletes, they will have this kind of hydration status data, because this is part of the performance contribution as well. Okay, but in a general population, we might not have this particular data. So that's also what triggered me to and my team to actually go for this study. Okay, so so that is just a bit on the justification. So basically, this particular study will look at the water intake, okay, and some of the social demographic characteristic, urban versus rural area. But because this is just a preliminary study, so we can only do it in Klang Valley, so it's not going to be like a nationwide study like NHMS, for example. Okay, so and to measure the hydration status, we are going to use urine sample. Okay, actually my postgrad student is considering to look at the blood sample as well, but we will maybe next time when we report the result, we can actually include the blood parameters as well. Okay, but for the FRGIs, actually I just mentioned the parameters, actually the urine indices. Okay, and also we want to look at what are some of the potential factors that will contribute to whether somebody will have dehydration or good hydration status. Okay, so looking at all the various possible contributors of factors. Okay, so that is also part of our study, that when we go collect data, we also will look at some of these potential factors to gather the data, so that we can have a more comprehensive picture of not just the intake and what the hydration status, but what are the potential factors that also will contribute to the data that we are actually getting. Okay. Okay, so because this is like the other speakers, this particular project was just granted last year in September, so about 1 year ago. So we just received our ethics application like last month. Okay, so we are in the process of just to start our recruitment. Okay, so we have identified most of the places that we are going. Okay, just the process of recruiting the subject is currently ongoing. So we hope to get it complete maybe by the early next year, so we can actually complete our first part of the study, that is the data collection part. Okay, so just to share, I think the grant processes, like most of the speakers have just shared. I won't go through the actual grant application. Just why we go for this one is also one of the reason is beside I'm part of the writers for the Malaysian Dietary Guidelines for water, is that this also actually was a preliminary discussion in one of the company that actually deal with water, but somehow the project didn't materialize. Okay, so we have a few rounds of discussion with the industry partners actually, but somehow this project didn't manage to get through. But I was thinking, we have actually got it somehow written down and the project is there. Okay, so I say, why not just we go ahead and apply for the FRGS, okay? Because we don't have anything to lose by applying for the FRGS. So I just say, okay, I'm going to take it up and just apply for the FRGS project, because I think we have all the ideas there. Just a bit of beefing up the project and getting everything in order according to the FRGS guideline. Okay, so I think everyone have seen the guidelines, have applied. I've applied almost every year. I've been applying FRGS. Okay, so you can imagine since the manual FRGS, not the my grant system yet. So we have been I've been applying almost every year. Okay, so the success rate is like, I think I just got one FRGS before this FRGS. So that was like the time when they don't have the my grant system computerized system, so all the manuals time. Okay, so you can see the success rate is not going to be very high, but we just apply. Okay, I think the other speaker have mentioned it's not going to be like apply first time you sure get, but some will actually do have that kind of success rate as well. But for me, I think I have been applying almost every year. Okay, so but 2021 this grant was actually approved. Okay. And the challenges currently I face is that, because even though it's like mentioned that you need to have the bonus to get industry partners, right? So I'm still looking and finding industry partners if possible, okay? But if not, maybe I'm not sure like whether I can work with other institution or other communities as part of the partners that is actually needed for the FRGS. Okay, and at the beginning, as the other speakers have mentioned, getting talent or postgrad student to work on the project is actually very difficult. Okay, so as usual, been sharing advertisement, asking around. Okay, so I guess the trend of students nowadays are not very keen on doing postgrad. Okay, so we need to be prepared for that, because some of them might think it's better to straight away go to find work rather than do postgraduate study. But there will be some who are still interested. So it's like, really, if you get to find a student that is interested, that we just straight away grab them sometimes. Okay, but because like there's so many people, especially lecturer, looking for postgrad students, so like they are actually quite in high demand. Okay, so even my colleagues currently are also still looking, some of them, okay, for other projects as well. Okay, so this will be some of the challenges that sometimes even getting grant is also a challenge. After getting grant, to get the postgrad student can also become another challenge for us. Okay, so but thank God somehow managed to get student to start off, but I only managed to get her like early this year. Okay, so that able to continue on with the project. Okay, so what would be the future direction for this project, and how we can actually somehow contribute, okay, to the nation somehow. Okay, so hoping to find industry or institution to work together with. Okay, so this is something that maybe in the future we can expand this study. Okay, and maybe looking at other population as well, because there's a lot of question to me, especially why don't you look at the elderly, because maybe that will be a need, because as we all know, the elderly might be the one that is losing their thirst mechanism, right? So maybe they might have difficulty getting sufficient of water intake, and maybe their hydration status might be very poor. Okay, so maybe in the future we will look at different population as well, and also among children also. Okay, so we hope to expand if possible. Okay, and I think the one of the things that I hope this study will contribute is actually to the future Malaysian dietary guidelines, because this will actually give us the data, actual Malaysian data, okay, to when we support why we need to consume how many glasses of water per day, because every time when I presented for the drink plenty of water daily, okay, so this will be something that people will ask, how do you know 6 glasses is sufficient? And if we say 8 glasses, then they will complain, it's too much of too many water that we need to drink already. Okay, so we need to like back this kind of recommendation to the public actually with some scientific evidence that is it sufficient to drink this much of water, or is it you need more, or you actually don't. If 6 glasses is sufficient already, then we can actually tell the population in that sense. So I really do hope this project can contribute in that way. Okay, so so because something that I'm actually very strongly involved in the MDG, so that's why for me this particular data will be very meaningful in the writing of the future MDG, hopefully. Okay, so I think that's all from me. I hope this short sharing is beneficial to everyone who is listening.
Okay, thank you very much, Dr. Loh, for that sharing. Water is definitely the basic thing for life. It's a very important research. Right, let's open up to the Q&A sessions. Are there any questions? Right, I think because we are heading towards the end of the webinar already. Okay, anyway, there's one of your slides, Doctor, and, one of the challenges is definitely to enroll a postgrad student. Yeah. So, and once we get the postgrad student, that's already a challenge. Enrolling, getting them one, and getting them inspired to kick on the particular project that's there. So, what actually happens is, in certain cases, this particular postgrad, they actually resign within 3 months and 6 months, leaving the PIs quite frustrated because
Yes.
we need to finish the research within a stipulated time. 2 years or 3 years, the research has already been kickstarted, and the PI may also be a researcher in so many other projects. So we are left like dangling over there, and then we'll have to search for a new research assistant and all the other headaches. So maybe you can share with us some tips in actually why this GRA, they choose or resign, sometimes quickly, very within 3 or 6 months, and maybe how can we motivate them to keep on being with us at least at the end, until the end of their candidature, or at least until we finish our grant?
Yeah. I think I got a few cases of maybe early part as well. So that is, I find that if they tell us earlier, maybe we can still like try to look for other people to help us. Okay, but I do have some who actually have just finished data collection and gone MIA. I was like really frustrated because most of the data was with them. Okay, so we actually have problem like getting the data from them, and some of them didn't graduate. Okay, so this will be some of the challenges as well. Okay, because I think I have like 3 students that halfway through just gave up. Okay, some collected halfway, some actually most of the time almost finished the data collection. Okay, so we for me, I try to talk to them. ask them, because the first thing that always I ask students when they want to do postgrad is why you want to do postgraduate. If you just want to while waiting for other opportunity to come, then I really will advise them to think clearly what is the direction that you want to take, because this is not something that after you finish this one, you sure will get job, and then sometimes you'll be very frustrated why the job that I get is like almost similar to my friends who have been, or maybe the salary is lesser than my friends who have started to work right after they finish undergraduate. Okay, so all these things, or I will always ask them first, so that I put this to them, that this journey of doing postgraduate might not be that easy for you. Okay, so if you're not prepared for it, I think you should think clearly, even though I mean, like, I really want them. I really want that students, okay, because sometimes you advertise that maybe just one respond to you, okay, so maybe that is already like, oh, at least one responded to the advertisement, okay, but I will always try to ask them and tell them these are the expectation. I hope you can actually finish all these things, because sometimes I do understand halfway through they might have other things coming that we do not expect. So that's the thing that I would say we can't actually anticipate or have any intervention before that. Okay, so sometimes when they find it is too heavy for them, sometimes they do have some breakdown that we try to help them, but sometimes not all intervention can be successful, I would say. Okay, so I do have cases of students just gone missing like that with the data itself. Okay, so that is where I was like so-called like even like so-called blacklisted because the grant didn't finish accordingly. Okay, so sometimes that is the thing that like the track record is actually jeopardized because of that. So we try to help or talk to them as much as possible, but sometimes it's not that. Maybe some will not actually be able to be helped, I would say.
Yeah, thank you, Doctor. So the keyword would be the preparedness of the postgrad. Yeah. Right.
Yeah.
Oh, anyway, Doctor, we have got a question, actually two questions, but related to each other, kicking in for you. So someone has actually asked, what would be the recommended intake, whether it's going to be a normal drinking water or mineral water, and what would be, is either mineral water or drinking water, which is better, and how these different type of water actually affect the hydration status in our body?
Okay, so I think the mineral water is okay. Drinking water, assuming is from the tap, right? So it's just a tap water. So if you do not do a lot of processing to the tap water, there will be some minerals inside, but maybe not a lot compared to the mineral water, because the mineral water will be like harvested straight directly from the groundwater that should have a lot of minerals. Okay, but I think how it affects the hydration status is just depending also on the current diet and the environment and physical activity of the person. If let's say they have been like having a lot of like activities outside, and they are sweating a lot, so maybe the mineral water will help to replenish a bit of the loss of mostly the salt like sodium, potassium, and all the electrolytes as well. Okay, but it will not be like as much as if you are athletes. Okay, so athletes, maybe they will really need a lot of electrolytes to be replaced, because that will be something different. But for me, it will not have actually much difference on the hydration status if you're talking about general population especially. Okay, so it's actually not going to have so much significant effect on hydration status. Okay, but for I think the next question is on the recommendation for public, right? Whether we should be drinking more water or mineral water. I will recommend just drinking water would be sufficient. we do not need to purposely go and find mineral water to drink. Okay, so even other kind of filter water, as long as it's water, that will be actually good enough. So the recommendation even we have for the Malaysian diet guidelines is just drinking water only. So we never specify must be mineral water, or even we do not like promote any other kind of like water system that is like in the market for those kind of situation. Water will be just drinking water will be just fine. Any drinking water will be good enough for the population.
So yeah, water is water, any kind of water, as long as you take 6 to 8 glasses of water. How
Yes.
about like if it's mineral water and some people they don't take, because I've seen a person also that they don't take tap water at all. The house is just full of mineral water. So does consuming every day, throughout the year or years, mineral water, will it have any side effect in the body system?
I think it also depends on what other how is their dietary intakes like of or other minerals, because I think the contribution of mineral water, especially the minerals from mineral water, is not very high, but there will be some contribution, but it also will come from mostly it will come from um, the food that we actually eat. Okay, so I will not see any problem with that. Okay, but it's just that I will say that it will be costly to just drink mineral water.
Yes. You rather get your minerals from your food and drink
Yeah,
it
it
plain
will come
water.
from the food, most of it. Yeah.
All right. Thank you very much, Dr. Loh, for your insightful sharings. Yeah.
Thank you, everyone.
And okay, so I would actually like to invite all our speakers and also our MC to turn on your webcam so that we can have a photo shoot.
Okay, everyone, please be ready. Okay, on count of 3, 1, 2, 3, smile. Okay, one more time. Okay, on count of 3, 1, 2, 3, smile. Okay. Okay, sorry. One more time, yeah. Okay. 1, 2, 3, smile. Okay, done. Thank you.
Okay, so it looks like we have came to the end of our webinar now. Right. So I would like to actually thank all our speakers today, okay, for sharing their knowledge, expertise, and also experience in their various research fields and also in grant applications. Hope that all the tips shared today will serve all of us, the participants, the listeners, a good baseline for all of us to foot in a much more better grant applications and also to inspire us to conduct a much more impactful research. So thank you again, everyone. Thank you all the participants here for joining us today, and hope to see you all in the next coming webinars. So that's all from me. Thank you for being with me. And now it's up to you, Mr. MC.
Thank you, Dr. Nalina. Before we end this session, we have some housekeeping announcements. First, we want to encourage you to download the latest NRP document via this QR code or link that has been shared on the chat box. As for the e-certificates, you will receive it via email after you have completed our evaluation form. The link has been shared in the chat box by the Secretariat, and you can also scan the QR code that will be shared on the screen shortly for this purpose. We will leave this link online for about 20 minutes for participants to fill in the evaluation form. As we bring our webinar to a close, on behalf of the organizing committees, I would like to thank all speakers and panelists as well as our moderator for your time, the wonderful insights and sharing. For all the participants, we would like to thank you for your interest and spending your time with us. We apologize for any shortcomings throughout the event. Stay safe and have a blessed day ahead. I end my session for today's event with Wabillahi Taufiq wal Hidayah. Assalamualaikum warahmatullahi wabarakatuh. Once again, thank you everyone for gracing our webinar with your presence. We genuinely appreciate it. Thank you.